We begin by taking a look at type 2 diabetes. Young people are unknowingly developing type 2 diabetes, making it one of the most common health concerns in Canada. A person can live with undiagnosed diabetes for up to 7 years before receiving a diagnosis, meaning patients can experience diabetes-related complications for years without treatment. A new technology is hoping to change that. Let's go to Dr. Abhinav Sharma, MUHC cardiologist and clinician scientist. Dr. Sharma, welcome to the show.
Thank you very much for having me.
So let's talk about this. What is this new? And I see the word AI, so I see that's artificial intelligence, right?
Absolutely.
So tell me, what is this all about? How are you diagnosing type 2 diabetes earlier?
Well, currently the most standard way of diagnosing type 2 diabetes is through a blood test. So individuals would often have to fast or have a blood test that's done through their family physician's office. But as we've seen, and especially through the pandemic, a lot of people don't have access to their family physicians, and a lot of people in Quebec don't even have family physicians at all. And so we understand that diabetes can develop far before individuals are ever diagnosed. So we're exploring the use of a wearable device that can actually be put on your wrist, and within 24 hours, using the signals that your own body generates and artificial intelligence, it could be used to flag people who may be at high risk of diabetes so that individuals can be notified, and then they can take preventative actions, such as speaking with their doctors or getting referred to specialty clinics so they can be formally diagnosed.
And how are you deciding who should be wearing this device?
Well, right now, we're in the development phase. So we're doing a study at the McGill University Health Center in collaboration with a number of Quebec-based partners, such as Hop Technology. And right now, we're piloting this on 200 people to see if the technology can actually work in a way to accurately screen and diagnose type 2 diabetes. Our preliminary results are very encouraging, showing us that really these types of wearable devices and wearable technologies can screen and use the signals that our body are producing all the time to help identify those who may be at risk.
Okay, so what are those signals? That to me is the fascinating part here. What are these signals that a wearable device can detect that could give a doctor an indication, oh, this person has type 2 diabetes?
Well, there are a number of them that we could look at. So, for example, in the particular device that we're looking at, which is developed by Hop Technology here from Quebec, we're measuring a variety of signals, such as your skin temperature, the temperature of the atmosphere around you, how much you're sweating and the conduction through that sweat, your heart rate variability, and how much you move. So all of these features, when combined, can actually help to tease apart those who may have diabetes compared to those who don't. For example, we know that people with diabetes often have issues with sweating because diabetes can affect the nerves. So this can be picked up by the device long before people ever develop any symptoms. So that's why we hope to bring it all together in one device to really put the power in people's hands so that they can be appropriately screened.
With Dr. Abhinav Sharma talking about a new program to diagnose type 2 diabetes earlier. Okay, so getting back to like the types of people that you may want to have wear this device for a bit, right? So, I mentioned off the top young people. Is that who you're looking at here more specifically? People that are spending 7 years without a diagnosis?
Absolutely. So we know that a lot of Canadians go a long time before they're ever diagnosed. As a cardiologist and a clinician who specializes in people who develop weak hearts as a result of complications from diabetes, I often see people showing up to the emergency room with heart attacks, heart failures, and strokes. They never knew they had diabetes, but unfortunately when they show up, their blood work shows that they've had diabetes, and likely for a long period of time. So that's really what we want to prevent from happening. And so we're aiming to target a broad spectrum of the population. So both young people, absolutely, but even older people who may not have been screened for a long period of time, and those people who may have already had heart attacks and strokes in the past, to make sure that they're appropriately screened so that we don't miss diabetes developing in the future.
Okay, so getting to that screening and catching this earlier, are there any things our listeners should be looking out for that they should go to their doctor and discuss that maybe they're glossing over? They're saying, that's nothing, when they really should be talking to their doctor?
Absolutely. So we generally know that if you're over 40 years of age, you really should be having a discussion with your physician and your healthcare providers about whether it's appropriate for you to be screened for conditions like diabetes, high blood pressure, and high cholesterol. Now, there are a couple other things as well. So if you have a family history of type 2 diabetes, if people already have, let's say, other conditions like high blood pressure, if they've had a family history of heart attacks or strokes, these are things that really should get you to think that, maybe I need to speak with my healthcare provider in order to get screened. In terms of symptoms of diabetes is caused when sugar goes up really high. So people are often getting, let's say, lots of tremors, extreme cravings for food, or they're drinking a lot of water even though it's not very hot outside. These may be some other flags to think about when considering if you may have diabetes, and something to really talk to your doctor about.
Okay, and for this wearable device, doctor, how many people do you want to have outfitted with this? What for the actual device itself? How are you going to move forward on this?
That's great. So the program we're launching is called the Decide CV program, and it's going to be launched through the McGill University Health Center in collaboration with our research institute and our foundation. You know, the sensors that are on this particular device can theoretically be found on almost all commercial devices, such as Apple Watches, Fitbits, Samsungs, and other devices as well. So if we can develop the proof of concept to show that this works, in theory, it could be scaled across multiple devices and multiple platforms. That way, we can have a tool that can screen, let's say, a whole population very rapidly so that people can really gain an understanding of whether they may be at risk for diabetes and take steps to help diagnose the condition.
Oh, so this is a really interesting point, Dr. Sharma. So the technology being designed here is something that software-wise can be put on a lot of devices people already own.
Absolutely. And we're really proud that this is a Canadian-based, intervention and project that's leading the way in this field. But the devices and the algorithms that are produced, in theory, can go on many different types of watches as well. So that's where we see this expanding in terms of a public health point of view. It could be used by a lot of people, even if they don't have our specific watch. These algorithms and AI can be introduced on many different types of watches. Very
interesting, Dr. Sharma. Is there anything else that I've forgotten to ask you about here that you want to mention?
Well, the project we're launching, couldn't be done without the support of our collaborators, including Hop Technology. We have partnered, of course, with the Ministry of Economy and Innovation, and we're working with companies that are in the diabetes space, such as Boehringer Ingelheim, and finally, the McGill University Health Center Foundation for their support. So I just wanted to give them a shout out for helping us to get this Canadian endeavor launched.
Dr. Sharma, thanks so much for coming on today.
Thank you so much for having me.
Dr. Abhinav Sharma, MUHC cardiologist and clinician scientist.